Oh, you guys are doing a lot for me.
At this rural health clinic in California's Central Valley, low-income patients depend on the services here to survive, both physically and financially.
Do you live in a canyon or do you live up high?
Dr. Carson Chambers is the clinic's psychologist and says the majority of his patients rely on government assistance.
There's no frills here. No one's taking advantage of anything. They're trying to survive.
But now, social safety net programs are at risk under President Trump's mega law, which slashes Medicaid and food stamps. An estimated 10 million people are expected to lose their health insurance under the law.
How badly do people actually need this health care and this health insurance from the government?
It's critical. It's the difference between living on the street and under the influence and causing all kinds of problems to being functional.
At 22 years old, Rick Garcia was permanently paralyzed after he leaned against a faulty railing on a bridge and plummeted backwards.
I fell 27 feet, landed on some rocks on my head, and I broke my neck. Yeah, that changed my life right then and there.
Bound to a wheelchair and unable to work, he lives with his mom, Elaine, and has been reliant on Medi-Cal, the state's Medicaid program, ever since. That allows him to receive some of his care here at the Bakersfield American Indian Health Project.
Without Medi-Cal, I'd be broke. I'd be really broke.
This key swing district is home to huge swaths of farmland. It has been represented by Republican Congressman and dairy farmer David Valadao for 10 of the last 12 years.
Valadao's district has the second highest share of Medicaid recipients in the entire country, according to an NBC News analysis. And this hospital here in Bakersfield gets 72% of its revenue from the state's Medicaid program. This hospital serves as a critical lifeline for the community. Without it, many residents would have nowhere to access care.
Valadao repeatedly vowed to oppose the mega bill, citing his concerns over steep Medicaid cuts and the impacts on rural hospitals.
And I will not support a final reconciliation bill that risks leaving them behind.
But under pressure from Trump, Valadao ultimately voted yes. His office said he was not available for an interview for this story. But he previously defended his decision in a statement, saying, "I voted for this bill because it does preserve the Medicaid program for its intended recipients, children, pregnant women, the disabled, and elderly." His vote has made Valadao even more vulnerable in next year's midterm election.
He ended up voting for it. How does that make you feel?
Yeah, definitely betrayed.
Valadao already faces two challengers, including Democrat Jasmeet Bains, a doctor and California State Assembly member.
When I saw Valadao vote for the big, beautiful bill, I was shocked. How could you do that in a district that has some of the highest needs, some of the highest Medicaid patients in the country?
The agricultural region is dependent on migrant farm workers who are also targeted in the mega law, which kicks non-citizens off of Medicaid, leaving the area nicknamed America's breadbasket, bracing for a healthcare gut punch.
Are you guys worried that you might be impacted?
Oh, definitely.
Yeah. Definitely.
Definitely, yes. And that will have a big impact on our lifestyle and a big impact on our pocketbook.
Melanie joins us tonight live from Los Angeles. So, Melanie, going back to Rick, who you just spoke to there, bound to a wheelchair with his disability, what does this bill mean for his coverage?
Well, Tom, Republicans insist that only people in their view who don't deserve to be on Medicaid are going to be kicked off the program. So undocumented immigrants or people who are able-bodied but choose not to work. However, Medicaid has already tried to kick Rick Garcia off of the program twice already, and he has had to appeal. And so he's very worried that he and many other people are going to potentially be wrapped up erroneously in all these new changes. And not to mention, there's also going to be new paperwork, new requirements, more frequent eligibility checks, all of that making it more burdensome for people to stay on the program. And it's sparking a lot of fear in the community in Bakersfield, which relies so heavily on these social safety net programs.
Yeah, so rural hospitals, as you know, they account for, I think it's about 1/3 of all community hospitals nationwide. So some Republicans who voted for the president's big, beautiful bill are now trying to sort of walk back some of the ways it could impact those rural hospitals. What exactly are you hearing?
Yeah, it's a pretty remarkable dynamic, one I've not really seen in my 15 years covering Capitol Hill. There are multiple Republicans like Josh Hawley of Missouri who voted for the mega bill who are now trying to walk back and reverse some of the Medicaid cuts. Specifically, Hawley introduced a bill that would roll back one of the provisions that essentially reduces funding for rural hospitals. Those changes are not supposed to go into effect until 2028, but if they do, there's a lot of concern that some of these rural hospitals are going to have to close their doors. And in places like Bakersfield, there's not a lot of options for people to get care. Rick Garcia, for example, has to drive 45 minutes already just to receive some of his care. But at this point, Tom, no signs that Congress is planning to roll back any of those changes.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.